Hi, I'm Dr. Sam Martin. I'm an orthopaedic surgeon based in the Coffs Harbour and Clarence Valley region on the east coast of Australia. And today I'd like to talk about total hip replacement surgery. A total hip replacement is a procedure you might consider if you've got a worn out hip, which is medically termed osteoarthritis or some other form of arthritis, and things are really catching up with you and you feel you're no longer getting away with it despite the sensible alternative treatments. It's important to realise that hip arthritis is sometimes misdiagnosed. A common enough sign of arthritis in the hip that sometimes people don't realise is groin pain. Hip arthritis can also show itself with knee pain and no hip pain at all. Other people sometimes mistake sciatica for hip pain or hernia pain for hip pain. So any pains in those regions or ongoing difficulties might prompt a review with an orthopaedic surgeon to get to the bottom of what the problem is. If you do have problematic hip arthritis, then a total hip replacement can be a good consideration. That's a procedure that involves recreating the ball and socket with a new stem in the top of the thigh bone and a new ball on top. And then on the socket side, grinding out the socket to put in a metal cup with a plastic cushion. I do this operation via the anterior approach, going between the muscles from the front of the hip. The recovery from a hip replacement usually involves a night or two in hospital and then often some physiotherapy after that. You would typically have a wound check at about 2 weeks, and by about 6 weeks, feel on the mend and back to your activity levels before the surgery and ready to go back to work. A hip replacement certainly is a significant consideration, and there are some risks and things that can go wrong after a hip replacement. So it's important to have a good discussion with me or another orthopaedic surgeon about whether a hip replacement is the right thing for you. But if you decide to go ahead with it, then it certainly can give excellent relief from severe hip arthritis problems. There are some misconceptions about hip replacements out there in the community. A common one is that hip replacements only last 10 to 15 years, which is not true. For many patients, a hip replacement would have a good chance of lasting the rest of their life. There are also ideas out there that you can be too young for a hip replacement, which is also not really true. Severe hip arthritis at a young age can be a very miserable situation, and a hip replacement can really be a good option if you find yourself faced with that.